helping make your life easier. Moms Every Day.
Welcome to Moms Every Day, everyone. I'm Sarah Sager, joined by Stacey, the CEO of Ohio Valley Physicians. We're so excited to have you here today. Thank you.
Thrilled to be here. Thanks for having me.
Well, I have a couple of questions for you. So some people in our viewing audience might remember OVP Health from its previous name, Ohio Valley Physicians. So I just actually said it wrong myself. But give us a brief overview of OVP Health and the kind of company that it's grown to become.
Well, we started in 1999. My father started the business with his business partner, Dr. Robert Hess. We started out in Ironton, Ohio, managing an emergency room for a small hospital there in Ironton. Since then, we've expanded our services to include hospital services, outpatient, family practice, primary care, and just recently opened up a recovery center in South Point, Ohio, that we provide inpatient rehabilitation services. So really, what started in 1999 as Ohio Valley Physicians over the last 20 years has grown into OVP Health, which has offices in 5 different states and over 300 employees.
Wow, just an incredible journey there. Let's talk briefly about each of OVP's health service lines. First, about how you help local hospitals by staffing and managing some of their emergency departments and hospitalist departments. I know that's a big job, especially right now during the pandemic.
No question, and hospitals look for us to really recruit and staff the emergency rooms and hospital services. And that goes anywhere from just scheduling shifts to working with the hospital and creating policies and procedures to help create better outcomes for the patients and higher patient satisfaction scores. And that can be as simple as, if you've ever been to the emergency room, the longer you stay in the emergency room, the less happy you are. And so some of our processes is trying to get people in and out of the emergency room a little faster to create a better experience for the patient.
Sure. We've all been there a time or two, especially with kids, right? 10 years ago, right before the opioid crisis really exploded in our region, OVP Health also got into the business of outpatient treatment and counseling for people battling opioid addiction. I know that has recently grown with your new facility in South Point as well. Can you talk about how that service line has grown and developed for your company?
No question. It's a huge part of our business and what we do as a company. We started with MAT Services, which is Medical Assisted Treatment Services. And what MAT Services is inclusive of, it's medical treatment of opiate use disorder in conjunction with counseling and behavioral health services. And we started providing MAT services in our Gallipolis, Ohio family practice in 2011. And since then, that's really driven a lot of our outpatient growth. Again, we have 24 offices in 5 different states. And over the 10-year period, it's been a terrific run as it relates to providing services to these folks who truly need help. I think, as most folks back in 2011, I didn't realize how bad the problem was. And once you get into providing these type of services, you really get exposed to, the depths of the pandemic as it relates to opiate addiction.
Yes, it's been even further this year because of isolation and the pandemic.
No question.
The tri-state region of West Virginia, Kentucky, and Ohio, often referred to as the epicenter of the opioid crisis. I would imagine that spending 10 years on the front line of that epicenter would give your doctors, counselors, and other healthcare providers a really unique level of experience to help people overcoming addiction. Is that right? There's
no question. I mean, we've been at the front lines of this problem since 2011. Currently we employ over 45 counselors. We're a CARF accredited program, and what CARF is a Commission on Addiction Rehabilitation Facilities, and that just gives you the stamp of we're always trying to better improve the processes we have to provide the services that we provide. But over the 10-year period, we've seen some terrific results as it relates to providing these services and people getting back to work, getting their families back. We've had a patient tell us one time that he hadn't stolen anything in 90 days. And so, when you're dealing with this population, success is relative.
Right.
And so you got to remember that. And so as we tell our folks, we have a tremendous responsibility. These folks come in wanting help to really to make an impact, not only on that patient, but that community. You think about how much better that community is because that patient hadn't stolen anything in 90 days. And so really it's an awesome responsibility. Our team does a terrific job, and we couldn't be more proud.
Baby steps, baby steps. Finally, in November, OVP Health expanded its addiction services line with a new opening of an inpatient. We just talked about that South Point, Ohio center called OVP Health Recovery. We don't have much time, but just tell us about how it's making a difference.
It's been a terrific resource for us as relates to taking care of our patients. There's certainly patients that would come into our office that need a higher level of service. We now have a place to send them. It's a 62-bed facility, a medical detox, 16 of acute detox, and so we've had a terrific success with that so far opened in November of 2020. And so once they've completed our 30-day process over at the Rehabilitation Center, we're able to transition them into one of the outpatient offices and continue to monitor them and hopefully get them back to work and doing well.
Making a big difference in our community. Thank you so much for being here. We really appreciate it, and thank you all for tuning in to Moms Every Day.